What type of problems does EMDR treat?
So most people think of post-traumatic stress, like PTSD, but also it's like any other mental health issues like anxiety, depression, low self-esteem, also with pain disorders, panic attacks, sexual and physical abuse, any kind of trauma, performance anxiety, the list goes on. It's just basically what kind of disturbing experiences have you had in your life, and would you like to work on them so that that experience isn't as intense, and so that we can decrease that suffering, the psychological emotional suffering, so that it's much better for us to continue our lives.
Does it work?
I think so, yeah. I mean, I did it too, and you know it helped me remember and understand what happened, and then with that knowledge, I was able to like heal more from it, and then I could integrate. Okay, so it was something bad happened. Now I know what it is more. Okay, how do I handle it? And how do I move forward in a healthy way?
Yeah.
Right. And so I think that piece of it transforming those emotional suffering into something that's like it's part of you. You're not going to forget these things that happened, whether it's a trauma from being a first responder or childhood trauma. Learning about like another big one is learning about terminal illness is huge. So having that doctor's appointment tell you, hey, you don't have much time, that's also a traumatic memory or
Yeah.
experience. So it's how do you use these past experience and integrate into your life so that you can move forward and not have the emotional suffering that you maybe had before. How long will it take?
Yeah.
Well, if they have five traumatic memories, it'll take a couple sessions per memory.
Right.
So if it's like, one single event, then it could take up, it could take a couple.
Right.
But then as they're more complicated, more complex, especially if they're all intertwined with each other and affecting each other, it could take months. The important part, of course, is assessment in the beginning. So we're not just going to jump into the BLS, EMDR right away. For me, it's assessing what's going on, what risk factors they have in their life. Are they using substances or medications? Um, do they have time to be in consistent therapy? And then, so assessing all those factors, right? Like if they're going on vacation for a month, it's not appropriate to start that process because we're in the wound,
Yeah.
right? So we're not, I have a lot of evaluation to do. Like, is this person ready?
Right.
Also insight, if they're not even thinking about it, and if they're so triggered that they can't even like talk about it or have the insight to reflect about what it is and how it's looking up in their life, like any kind of insight, then that's also hard too. If they're psychotic, probably not the best. Right. So it's a lot of assessment preparation.
Yeah.
And then a lot of the beginning part is to make sure that they can handle during sessions and then after. Like I wouldn't want a client or patient to be so emotionally charged to walk out of the room.
Yeah.
And then be in real life in the world and be so triggered. So
Right.
there's a lot of techniques of like, visualization, breathing techniques, like light energy, that like visualization to make sure that when they are out of session, that they can have these coping skills so that it helps them like through those moments. And then when we come back to the next session, then we can go from where they're at.
If we were saying, all right, someone's coming in for trauma and we want to give them the best opportunity to heal, and we've got unlimited funds and we have 6 months of time, what do we do for this person?
I would say some kind of like mental wellness, like meditation, like mindfulness, right? If they do meditation, great. If they do yoga, great. If it's learning how to do coping skills, I think that's a great wraparound because you can only do so much, right? Like as a therapist or a physician in a room with a certain allotted time, a lot of the healing happens outside. So it's like what kind of environment and activities or hobbies or kind of lifestyle is needed to have the most optimal healing.
Yeah.
And so it's exercise, diet, being around supportive people. If it's a community center, if it's like yoga group or even group therapy, I mean, it depends on the setting.
Yeah.
But like, I think just, it depends per person and what makes them feel good and calm and relaxing, right? I think it's an assessment piece, but kind of a wraparound is what I'm saying. Like what issues in their life are they coming to for seeing a therapist or provider?
Right.
And then outside of those spaces, what can they do to maintain and continue healing?